Gentlemen, let me ask you something with complete honesty. How many times did you get up to urinate last night? Once? Twice? 3 times? More? And when you finally drag yourself out of bed in the morning, exhausted from interrupted sleep, do you tell yourself this is just what happens when you get older? I'm Dr. Katherine Miller, specialist in men's health and vitality with over 12 years helping gentlemen like you understand what your body is trying to tell you. And today, we need to have a serious conversation about something that millions of men suffer in silence: Nocturia, those multiple nighttime bathroom trips that are stealing your sleep, draining your energy, and signaling something far more important than simple aging. Because here's the truth that most doctors won't tell you clearly enough. When you're waking up 3 or more times every night to urinate, your prostate isn't just being inconvenient, it's screaming for help. It's sending you an urgent message that something fundamental has changed in your body, and ignoring that message could lead to complications far beyond just poor sleep. Stay with me, because what I'm about to share could literally transform your nights, restore your energy, and potentially save you from serious health complications down the road. If you want more men to access this critical information that could change their quality of life, hit that like button right now and subscribe, because we're going to explore topics that your doctor probably hasn't explained with this level of clarity. Let me start with a question I hear almost daily in my practice. Dr. Miller, I'm 63 years old, and I'm getting up 4 or 5 times every night to pee. My doctor says it's normal aging and wants to put me on medication. But I'm exhausted. My wife is frustrated because I keep waking her up. And honestly, I'm starting to avoid drinking water just so I don't have to get up so much. Is this really just normal? Or is something seriously wrong? This question comes from men who are suffering. It comes from exhaustion that accumulates night after night, month after month. And it reflects a dangerous misconception that the medical system often reinforces, that frequent nighttime urination is simply an inevitable part of getting older, that you just have to accept. But that's not the full truth. Yes, prostate enlargement is common as men age, but the severity of your symptoms, the frequency of those nighttime trips, and the impact on your quality of life are not inevitable. They're signals, warning signs. Your body's way of telling you that your prostate is under stress, inflamed, or growing in ways that need attention. Here's what's really happening inside your body, and why understanding this is absolutely critical. Your prostate is a walnut-sized gland that sits directly below your bladder, wrapped around the urethra like a donut around a straw. When you're young, it functions perfectly, producing fluid that nourishes and transports sperm. But starting around age 50, something changes. For reasons that involve hormones, inflammation, and cellular changes, the prostate begins to enlarge. This condition is called benign prostatic hyperplasia, or BPH. As the prostate grows, it squeezes that urethra, creating a partial blockage. Suddenly, your bladder has to work harder to empty. It becomes irritated, overactive, and hypersensitive. Here's the crucial part most men don't understand. When you wake up 3 or more times at night, it's not because your bladder is actually full. Studies using ultrasound show that men with severe nocturia often have less than 200 milliliters in their bladder when they feel that urgent need. That's less than a cup of liquid. A healthy bladder can comfortably hold 400 to 500 milliliters. So what's happening? Your bladder has become so irritated by the chronic obstruction and inflammation that it's sending false alarm signals to your brain. It's like a smoke detector that goes off from steam, not actual fire. Your bladder is screaming, "Emergency, we need to empty now," when there's barely anything there. A landmark study published in the Journal of Urology followed over 3,000 men for 5 years. They found that men waking up 3 or more times per night had significantly higher rates of depression, accidents due to daytime fatigue, reduced work productivity, and even increased mortality risk. Yes, you read that correctly. Chronic sleep disruption from nocturia is associated with shorter lifespan. Why? Because quality sleep is when your body repairs itself, balances hormones, consolidates memories, and regenerates tissues. When you're waking up multiple times every night, you're never reaching the deep, restorative sleep stages your body desperately needs. You're running on empty, day after day, and your entire system suffers. Now, before I explain the solutions, let me share the 3 biggest mistakes that are making your nighttime urination worse. Because even if your prostate is enlarged, these errors are pouring gasoline on the fire. Mistake number 3, drinking large amounts of liquid right before bed. I know this seems obvious, but you'd be shocked how many men drink a full glass of water, tea, or worse, alcohol within 2 hours of bedtime and then wonder why they're up all night. Your kidneys continue producing urine for several hours after you drink. A study in neurology and urodynamics found that men who consumed more than 300 milliliters of fluid in the 2 hours before bed had 67% more nighttime bathroom trips than those who stopped earlier. Here's what I recommend. Front-load your hydration. Drink the majority of your water between morning and early afternoon. Taper off significantly after 6 p.m. If you're thirsty in the evening, take small sips, just enough to satisfy, not full glasses. Mistake number 2, consuming bladder irritants, especially caffeine and alcohol. Caffeine is a diuretic, meaning it makes your kidneys produce more urine. But it also directly irritates the bladder lining, making it more sensitive and reactive. Alcohol does the same, plus it disrupts your sleep architecture, making you more likely to wake up. Research from the American Urological Association shows that men who consumed caffeine after 2 p.m. had significantly worse nocturia compared to those who stopped earlier. And alcohol, even just 2 drinks with dinner, increased nighttime urination frequency by an average of 43%. One of my patients, Robert, age 68, was waking up 5 times per night. When we analyzed his habits, he was drinking 3 cups of coffee throughout the day, the last one at 4 p.m., and having 2 glasses of wine with dinner every night. Within 1 week of eliminating afternoon caffeine and reducing alcohol to weekends only, he dropped from 5 nighttime trips to 2. One simple change, dramatic results. Mistake number 1, ignoring the underlying inflammation and metabolic factors. This is the mistake that keeps you trapped in a cycle of worsening symptoms. Most men think nocturia is purely mechanical. Big prostate equals blocked flow. But research now shows that inflammation, metabolic syndrome, obesity, and insulin resistance all significantly worsen prostate symptoms. A comprehensive study in the European Urology Journal found that men with metabolic syndrome, that's the combination of belly fat, high blood sugar, elevated blood pressure, and poor cholesterol, had 2.3 times more severe urinary symptoms than men without metabolic issues, even when their prostates were the same size. Why? Because chronic inflammation from poor diet, excess weight, and metabolic dysfunction causes the prostate tissue to become more reactive and swollen. It's not just about size, it's about how inflamed and irritated that tissue is. Now let me explain the 5 natural interventions that address both the mechanical obstruction and the underlying inflammation. These are the strategies that have helped hundreds of my patients reduce nighttime urination dramatically, often without ever needing medication. Solution number 1, targeted anti-inflammatory nutrition. The foods you eat directly impact prostate inflammation. Research shows that men who follow a Mediterranean-style diet rich in vegetables, fruits, fish, and healthy fats have significantly fewer prostate symptoms than men eating Western diets high in processed foods, red meat, and sugar. Specifically, you want to focus on foods rich in lycopene like cooked tomatoes, which studies show can reduce prostate inflammation by up to 32%. You want omega-3 fatty acids from fatty fish like salmon and sardines, which lower inflammatory markers throughout your body. And you want to eliminate or drastically reduce inflammatory foods, processed meats, excessive dairy, refined sugars, and fried foods. A clinical trial published in the Journal of Medicinal Food found that men who consumed a diet high in anti-inflammatory foods for 12 weeks experienced a 41% reduction in urinary symptom scores and significantly improved sleep quality. Here's your practical game plan. Start every day with a vegetable-rich breakfast, eggs with spinach and tomatoes. Include fatty fish at least 3 times per week. Snack on nuts, especially walnuts and almonds, and eliminate processed foods as much as possible. Your prostate will respond, often within just 2 to 3 weeks. Solution number 2, strategic supplement support with saw palmetto and beta-sitosterol. Now I want to be clear about something. I'm not talking about random supplements with exaggerated marketing claims. I'm talking about specific compounds that have solid research backing their effectiveness for prostate health. Saw palmetto is extracted from the berries of a small palm tree, and it works by inhibiting the enzyme that converts testosterone to DHT, dihydrotestosterone, the hormone that drives prostate growth. Multiple studies, including a comprehensive meta-analysis in the Cochrane database, show that saw palmetto significantly improves urinary flow and reduces nighttime urination in men with mild to moderate BPH. Beta-sitosterol is a plant compound found in nuts, seeds, and certain vegetables. Research published in the British Journal of Urology found that men taking beta-sitosterol experienced a 50% improvement in urinary symptom scores, and notably better sleep quality. The key is consistency and proper dosing. Saw palmetto typically requires 320 mg daily, and beta-sitosterol around 60 to 130 mg daily. You won't see results overnight, but most men notice improvement within 4 to 6 weeks of consistent use. One of my patients, Michael, age 71, was waking up 6 times per night and considering surgery. After starting a combination of saw palmetto and beta-sitosterol along with dietary changes, he was down to 1 or 2 nighttime trips within 8 weeks. He told me, "Dr. Miller, I forgot what it felt like to sleep through most of the night. My energy is back, and so is my quality of life." Solution number 3, pelvic floor strengthening exercises. Most men have never heard of pelvic floor muscles, let alone trained them. But these muscles, which run from your pubic bone to your tailbone, play a critical role in bladder control and urinary function. When they're weak, which happens naturally with age and inactivity, bladder irritation and urgency get worse. Research from the University of California found that men who performed pelvic floor exercises, also called Kegel exercises, for 12 weeks experienced a 36% reduction in nighttime urination frequency and significant improvements in bladder control. Here's how to do them correctly. First, locate the muscles. Imagine you're trying to stop urination midstream. That squeezing, lifting sensation? Those are your pelvic floor muscles. Now contract those muscles firmly for 5 seconds, then relax completely for 5 seconds. That's 1 repetition. Start with 10 repetitions, 3 times per day. As you get stronger, increase to 15 repetitions and hold for 8 to 10 seconds. The beauty of this exercise is you can do it anywhere, sitting in your car, at your desk, watching TV. No one knows you're doing it. Within 4 to 6 weeks of consistent practice, most men notice they can hold urine longer, the urgency decreases, and nighttime trips reduce. You're literally retraining your bladder and strengthening the muscles that control it. Solution number 4, the double void technique before bed. This is a simple behavioral strategy that can dramatically reduce nighttime bathroom trips. Here's how it works. About 30 minutes before you plan to go to sleep, urinate completely. Then, 10 minutes before you actually get into bed, urinate again, even if you don't feel a strong urge. Why does this work? Remember, men with BPH often have incomplete bladder emptying. You think you're finished, but there's still residual urine sitting there, irritating the bladder. By urinating twice in close succession, you ensure maximum emptying before sleep. A study in the International Journal of Urology found that men who practice double voiding before bed reduced their average nighttime trips from 3.4 to 1.8 per night, nearly cutting the problem in half with just this simple technique. Solution number 5, sleep positioning and bedroom optimization. This might sound unusual, but how you sleep and your sleep environment significantly impact nocturia. Research shows that men who sleep with their upper body slightly elevated, using a wedge pillow or adjusting the bed, experience less fluid redistribution that contributes to nighttime urination. Here's what happens. Throughout the day, especially if you're sitting a lot, fluid accumulates in your legs due to gravity. When you lie flat at night, that fluid redistributes, increases blood volume, and your kidneys start working overtime to process it, producing more urine. By elevating your upper body just 6 to 8 inches, you reduce this redistribution effect. Additionally, keeping your bedroom cool, between 65 and 68 degrees Fahrenheit, promotes deeper sleep, making you less likely to wake up from minor bladder signals. Now, let me share a complete transformation story that ties all of this together. George, a 66-year-old patient, came to me absolutely exhausted. He was waking up 4 to 5 times every night. His marriage was suffering because he was constantly disturbing his wife, and he was falling asleep during afternoon meetings at work. His doctor had prescribed medication, which helped slightly but caused dizziness and didn't address the root problem. When I evaluated George, we found multiple contributing factors. He was drinking coffee until 3 p.m. every day, having wine with dinner, consuming a diet high in processed foods, carrying 35 pounds of excess belly fat, and had never done a single pelvic floor exercise in his life. We created a comprehensive plan. He eliminated caffeine after noon, reduced alcohol to weekends only, adopted an anti-inflammatory Mediterranean diet, started saw palmetto and beta-sitosterol supplementation, practiced pelvic floor exercises daily, and implemented the double void technique before bed. The results? Within 2 weeks, he dropped from 5 nighttime trips to 3. By week 6, he was down to 1 or 2. After 3 months, he told me, "Dr. Miller, I sleep through the night most nights now. My energy is back. I've lost 20 pounds, and honestly, my whole relationship with my wife has improved. I didn't realize how much this was affecting every aspect of my life." That's the power of addressing the root causes instead of just masking symptoms with medication. Now let me address the question many of you are thinking. What about medication? When is it necessary? Look, I'm not anti-medication. There are situations where medication is appropriate and helpful. If you've tried natural interventions consistently for 8 to 12 weeks without adequate improvement, or if your symptoms are severe and significantly impacting your quality of life, medication can be a valuable tool. The most common medications are alpha blockers, which relax the smooth muscle in the prostate and bladder neck, and 5-alpha reductase inhibitors, which actually shrink the prostate over time. Both have proven effectiveness, but they also come with side effects that many men find unacceptable: dizziness, fatigue, sexual dysfunction, and others. My philosophy is this. Start with the natural interventions. Give your body the tools it needs to heal and function better. If after a genuine, consistent effort you're still suffering, then consider medication as an additional support, not a replacement for healthy habits. But here's what you absolutely cannot ignore. If you're experiencing any of the following warning signs, you need to see a urologist immediately, not next month, not when it's convenient, now. Warning sign 1, complete inability to urinate. This is called acute urinary retention, and it's a medical emergency. If your prostate has swollen so much that you cannot pass urine at all, you need emergency care immediately. Warning sign 2, blood in your urine. While this can have various causes, it always requires medical evaluation to rule out serious conditions including bladder stones, infection, or malignancy. Warning sign 3, severe pain or burning with urination. This could indicate infection, stones, or other conditions that need immediate treatment. Warning sign 4, signs of kidney problems. If you're experiencing back pain, fever, nausea, or decreased urination despite fluid intake, your kidneys may be affected by the chronic obstruction, and this requires urgent evaluation. For everyone else dealing with frequent nighttime urination but without these emergency signs, you have time to implement the natural strategies we've discussed. And you have every reason to be hopeful, because the research is clear, lifestyle and nutritional interventions work. Let me give you a 30-day action plan that puts everything together in a practical, step-by-step format. Days 1 to 7, hydration and habit modification. Stop all fluid intake 2 hours before bed. Eliminate caffeine after 12 p.m. Reduce or eliminate alcohol. Practice the double void technique. Start tracking your nighttime bathroom trips in a simple notebook to establish your baseline. Days 8 to 14, nutritional transformation. Begin the anti-inflammatory diet. Add cooked tomatoes daily. Include fatty fish 3 times this week. Eliminate processed meats entirely. Reduce refined sugars dramatically. You're giving your body the nutritional tools to reduce inflammation. Days 15 to 21, physical intervention. Start pelvic floor exercises, 10 repetitions, 3 times daily. Add a 15-minute walk after dinner to improve circulation and reduce fluid retention in your legs. Elevate your upper body slightly when sleeping. Days 22 to 30, supplement support and evaluation. If you haven't already, start saw palmetto and beta-sitosterol supplementation according to label directions. Continue all previous interventions. At day 30, compare your nighttime bathroom trips to your baseline. Most men see 30 to 50% improvement by this point. If you're not seeing improvement after 30 days of consistent effort, that's your signal to schedule an appointment with a urologist for further evaluation. But I can tell you from clinical experience, the vast majority of men who genuinely implement these strategies see significant improvement. Here's the truth that the medical system often fails to communicate clearly. Waking up 3 or more times at night to urinate is not normal. It's not just aging, it's your prostate sending you a message that it's inflamed, enlarged, and struggling. And ignoring that message leads to years of poor sleep, declining health, and eventually more serious interventions like surgery. But when you take action, when you address the inflammation, support your prostate with targeted nutrition, strengthen your pelvic floor, and eliminate the habits that make everything worse, your body has a remarkable ability to heal and restore function. I've seen men in their 70s go from waking up 6 times per night to sleeping peacefully with just 1 or 2 trips. I've seen exhausted men regain their energy, their mental clarity, and their joy in life. And it all starts with understanding that your symptoms are not a life sentence, they're a signal that can be addressed. Gentlemen, you deserve to sleep through the night. You deserve to wake up refreshed, energized, and ready to live fully. Your prostate is screaming for help, but the good news is, you now know how to answer that call. So tonight, I want you to implement just one thing from this video. Maybe it's stopping fluid intake 2 hours before bed. Maybe it's eliminating that afternoon coffee. Pick one thing, commit to it, and notice the difference. Then come back and tell me in the comments what you chose and how it's working. If this video gave you hope, if it gave you a clear plan to follow, hit that like button and share it with someone who's suffering silently. Subscribe for more evidence-based content that addresses men's health with the honesty and clarity you deserve. I'm Dr. Katherine Miller, and remember, you are not broken, you're not too old, and you don't have to accept sleepless nights as your reality. Your body is speaking to you. Listen, respond, and reclaim the rest and vitality that are your birthright. Your best nights of sleep are ahead of you, gentlemen. Start tonight.